Do the Pledge of Allegiance. We can do that now. Pledge allegiance to the flag of the United States of America,
and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Are we live and ready, Melina? Hey. It is 7:02 and I call this regular meeting of the Board of Trustees.
Trustee Halverson.
Here.
Trustee Gardner.
Here.
Trustee Schnitger.
Here.
Trustee Wakefield. Trustee George is absent and Mayor Pro Tem Harper has not joined us yet, and Mayor Cranker.
Should we wait for Jim? For anybody listening on Zoom or on YouTube in the future, our Zoom login is a little different this evening, so just bear with us as we're managing kind of a new system for comments and everybody logging in, so we might be a little clunky. Okay. We're very prompt today.
Don't worry, they just text me directly and we're getting everyone on.
We'll give it just a minute for folks to be able to log on.
And if you are on YouTube right now, the new Zoom link and you want to participate in this meeting, the new Zoom link is posted on our Facebook page. So you can access the new Zoom link on our Facebook page.
I'm just trying to use the old link. He's on that.
Oh, well, but you got him.
Yeah, he said he's.
Will this be permanently the new link?
No.
No.
Very temporary.
Thanks, Jim. We just did roll call, so we'll note you as present.
Thank you.
All right, are there any staff or board revisions to the agenda?
I do not have any revisions at this time.
Great. Minor for our new board members, as you saw in the packet, this would be an opportunity for you to pull something from the consent agenda. Like if you felt like, oh, I need more information on that. I want to talk about that a little bit more. This is where you would do that. Okay, we'll now open it up for public comment. We have no one in person, so we will open it up to Zoom public comment. Again, we're a little clunky today. So,
You let Kim in.
Melina, can you tell if we have anybody for public comment?
Does not appear so.
Okay. We will close public comment and move on to presentations and proclamations. That would be me. So I'm going to move positions, but Becky Joyce is joining us. I'm moving us along here, Ron. You see
Thank you.
what's going on. So Melina, if you wouldn't mind bringing up the PowerPoint, I'm gonna move over here because I'm now wearing my public health hat instead of my Board of Trustees mayor hat. And we'll give it a few minutes. I'll just give a little background as we wait for Becky to join us. As we get set up. I'll give you a little bit of history. So I was before the board, with the previous board when we did a health assessment in 2022. And that's something that public health agencies have to do, every 5 years. It really just lets the community identify what are the top health priorities in the community, what are the top health needs. And then it builds a foundation for what would be a plan, so a public health improvement plan. And, this is something we have to submit to the state, but really we want to use it as a way to really be strategic around what are the top needs in this community? What are the priorities? What are the funding mechanisms? And obviously it's something that's not just owned by public health. There's lots of entities in our community that weigh in on public health. So that's kind of where we came from. So if you're interested in that, the health assessment is on the county's website, and you can see more of the data and stuff behind that assessment. Come on in, we're moving right along, Becky. You guys all know Becky Joyce, Director of Public Health. So I was just giving them a little history to start.
Great.
We're very efficient today. So Becky and I are going to kind of tag team here. Basically, I wanted to share with this board kind of where we are now. We did our health assessment where we looked at data. We did a bunch of informational interviews, focus groups, asked people what was really important to them. Health really came up a lot at the county commissioners election. And so I know it's on everybody's radar in various aspects of how to get it or how we aren't able to get a lot of it. You could go ahead to the next slide, please, Melina. But I think what's most relevant for you all is to know kind of what came out in all of this work for the top health priorities for San Juan County, which obviously most residents live in Silverton. And so the top priorities in San Juan County are access to care, behavioral health needs, and programs that specifically target priority populations. And those groups that really stood out in our assessment were adults that are age 60 plus. I don't know if you guys know, but over a third of our population is 60 and older. Youth and families, and our Latino residents. And so that's kind of how we focus. Those are the priorities that have emerged. And through our process, we put together a variety of work groups. So these are work groups that were focused on access to care, work groups that were focused on behavioral health, and some work groups that were focused on like, how do we access resources for these populations in particular. And then we moved on to our public health improvement plan. So you could go to the next slide, please, Melina. And so what the document you guys have in your packet is much longer. That's what we submit to the state. It provides a good bit more of demographics and information. And again, it's stuff that we can pull to kind of sell our story other places of what does our community look like? What are the needs that we see? But these are really the top 3 priorities. And Gloria actually stole this format from you for strategies and objectives. So thank you for your great administrative structure. But you can see their number 1 priority is to increase access to primary, oral, vision, and behavioral health care for San Juan residents. And, there are a variety of ways we can do that, right? We're always looking for how do we bring services here? It's most convenient if people don't have to drive down the valley, right? So how do we increase access here locally? But then also how do we create the right partnerships? So if we need to refer people out or if people need to seek care out of the valley, there are the right relationships in place. And then we're building the right partnerships for people to come up and provide services here or refer out. And the second priority is increased behavioral health services and utilization for San Juan County residents. And we'll talk about a couple ways that we focused on that. And then increase accesses to services for priority populations, and we list them there as well. And I kind of want to stand on number 3 for just a minute and highlight, this is where something called social determinants of health really comes into play. Some of you might be familiar with that phrasing, some of you may not. Basically, social determinants of health are the things that affect people's health, but aren't exactly going to the doctor or getting a screening, right? But where people live. Do they have access to safe, affordable housing? Do they have access to affordable childcare? What's their education access look like? What does their built environment look like? Their neighborhood, their environment, access to healthy foods and affordable foods. So those are the things that we don't always think of when we think of health, but they actually directly tie to people's health outcomes and even mortality rates. You know, so sometimes rates of heart attack can be tied to things like where people live, or mortality rates and death rates can be tied to things like where people live. So that's the social determinants of health piece. And again, under number 3, it's really about how do we build the partnerships in the region and locally to have services and programs here and connect people to the resources that we know are available outside of this space. And something that we kind of pay attention to is, you know, we're so little and oftentimes we get a little bit forgotten because we're very remote, we're geographically isolated. And so we've been trying to just make sure we're always having a seat at various tables. And Becky's been doing this for a long time. And then I've been able to add to it, just making sure that when there are regional happening, Silverton and San Juan County have a seat at that table to say, hey, you know, we don't expect someone here 24/7, but we could use this resource occasionally. So that's kind of what we focused on. So those are the 3 priorities. I'm not going to go into all the objectives, but you can see those in there. And like I said, this is something that public health owns. You know, this is something that has a relationship with the town. It has a relationship with the county. It relates to EMS and ambulance and fire. It relates to emergency management. It relates to the clinics that we have. It relates to the school. So it's all things that these various partners play into. So speaking of partners, I'm going to pass it over to Becky to help sort through who's who. So you can go to the next slide, please, Melina, because I know it gets kind of confusing sometimes about Miners Hospital and what in the world is happening in there and who's who.
Yeah, so please stop me if all of a sudden you're like, hold on, wait a minute. And you also have 2 very knowledgeable people on your board that know the ins and outs of the Miners Hospital. So essentially, San Juan County Public Health, we're 5 days a week, Monday through Friday. And as you can see in very small print, we employ about at least 8 positions. Because of COVID, we've had a budget between $500,000 and $800,000 for the last several years. That will come to an end. We thought it was going to come to an end at the end of this month, but it didn't, so that's nice. Before COVID, we had a budget of about $120,000 for 2 of us, two full-time people. Now we have about 8 people. Only 2 of us, myself and Amy, are full-time. And then we have a part-timer for finance. We have a quarter-timer for health planning and promotion, a quarter-timer for the emergency preparedness and response. And many of us wear a lot of different hats. So say Jim Donovan, we fund his position a quarter time, but then he also does emergency management under a different funding source. All of these grants pay for every single position. At this moment, we are not receiving, and we have not for 4 years received any funding from the county other than in kind for the building use. There's also Mary Varela. She was a newer position for a multicultural broker just to help promote more services. And then also Cassandra Roof. She really started doing some more senior outreach. She does classes like yoga and strength training over at the senior center and also helps us with our senior meals on Wednesdays. So we try to do it very creatively. The county commissioners, especially Willie, is always joking about how can we get some of our grants for a bulldozer, but we just haven't figured that one out yet.
Social determinants of health covers a lot of things. We haven't been able to figure out how it covers a bulldozer yet.
Yeah. We've also, in recent years past, the school has been incredible partners. And so we've also joined with them to utilize one of their full-time employees. You know, and so we pay the school to continue their full-time employee to be able to do a little bit of work for us. And there's just a lot of it's like a pot of spaghetti. There's noodles going everywhere. So essentially what are our services? We're public health. We do population-based services, immunizations, communicable disease is a huge one, obviously, maternal child health, so health promotion. And environmental health, we do get help from Durango. So La Plata County Public Health, no longer San Juan Basin. They still do our septic. So our on-site wastewater treatment systems that happen in the county outside of town limits. La Plata County Public Health, we just renewed a contract with them so that they mostly do that. However, now it's changing to where we actually issue it. So we're working with Bevan on that just to really solidify how that plan works. And then CDPHE, part of environmental health is food safety. So when you go to a restaurant, who's actually keeping track that they're not serving you food that's going to make you sick? That's public health. And CDPHE, who has actually been really well received here, will be doing the food inspections. They're going to be coming and doing food safety classes, which I'll let you know on the next slide. And so a lot just goes on behind the scene. La Plata County Public Health also does a program called Family Nurse Partnerships. So there's certain qualifications, but especially if someone is having their first baby and they qualify financially, they actually come up in person, a nurse does, and follows them through their pregnancy and then for at least a year after the baby's born. That's public health. There's WIC, Women, Infant, Children, air quality. We're also partnering with nearby regionally. I mean, there's just a lot of little everything. We just received naloxone for harm reduction and fentanyl test strips that we're hoping to promote at our health fair. So whenever you think of health, it's not just like getting an immunization or seeing the doctor. It just is widespread, as you all know. And then community mental health. I think you guys are all aware of this, that we do have one person on staff that offers appointments. He's oftentimes we pay through a CDC grant for him. We have secured funding for him for the next 4 years. And then we also just pay per service for several more people, including someone who's Spanish speaking from Durango. And what we want is 10 free sessions for anyone and everyone, because we don't want it to be a barrier for people we don't want it to be a barrier for them to receive therapy, counseling sessions, behavioral health. So we've been doing that for about 1.5 years, I think. We don't know how long that grant will last, but we're trying to keep it going. As far as I know, we might be the only county that does that.
Take advantage of it. I mean, these therapists can work with you through whatever, work-life balance, stress that's happening, family things. Anybody in town can get 10 free sessions.
Yeah, and so then we go over to Innovation Medical. That is our clinic on Tuesdays. Through this process of doing this public health improvement plan, and even before with Lois McKenzie, we knew the desire was to have more medical services in Silverton. And we had the Thursday, but we knew you don't just get sick on a Thursday. So we were able to connect with Innovation Medical Clinic. They set up satellites all over the West. And so they send up a nurse practitioner on a Tuesday. They are for profit, so it's either cash or essentially they bill your insurance. They're able to draw blood on those days. Even if you have a doctor's order from someone else, you can bring in a lab and get it drawn. And then, and they're really great. They actually have a connection to telepsych and telepsychology and all sorts of wound, pain care, pain control, all sorts of stuff. They're just like, we're just still peeling the onions. And so they've been a really great partner. And then the Silverton Clinic continues to run. Holy moly. They are just continuing to be on Thursdays, and they employ 2 people. The nurse practitioner is actually paid by a foundation from Mercy Regional Hospital, or it's not that anymore, though, is it? It's Common Spirit. But the other 2 people, this is what we do in our community. The main clinic nurse is also the school nurse who is subsidized by the county. And then the medical assistant, she also works on Tuesdays. She works on Thursdays. She can do telehealth on Mondays or all week if you want, kind of thing. And we actually through public health pay for her position on Thursdays because we want COVID testing to happen all day. So as you can see, we try to get really creative and really snappy.
And I think if you're talking to anybody, the big things to know is there are medical providers in this town on Tuesdays and Thursdays. You can see a provider. Silverton Clinic often has a full schedule, so they might be more booked out. Innovation Medical is often able to do a few more walk-ins. And then the one difference too with Innovation Medical is that they have like on-call providers, right? So if you can't get seen on a Tuesday and you're an established patient or you've seen them before, you have after-hours care and they can do telehealth other days of the week. But just know, like, if you're talking to anybody, there are providers here on Tuesdays and Thursdays.
And there's hopefully going to be a way where Innovation Medical on Tuesdays can order a X-ray at Purgatory Urgent Care and you won't be billed for the extra visit. And they can actually just do an X-ray. And so there's just a lot of stuff in the works. It seems to take a while, but it'll happen. So next slide, please. Whew, that's the biggest one. So upcoming events. And just what we've been doing with our funding
That's right. It's just thinking.
yeah. They'll have those moments. But essentially, the success that we've been able to do, and especially in the last couple of years with Dana's position, and obviously the office could not run without Amy. She's really, truly the boss, and I'm thankful for it. So, but the success that we've done, and one thing I didn't mention is, you guys know, Amy obviously does the tobacco prevention grant, but then she also does all the vaccines and does a lot of fiscal and does just overall everything. She COVID tests, she could contact trace. She's just trained a lot. And you don't see that with a lot of our public healths around the state.
Thanks, Melina.
So, something that's been really, as you can see, there's a lot of things happening. With Dana's position, we've really been able to reach out to regional partners, like we said. The mobile market is really cool. I don't know if any of you don't know what this is, but it brought food. Was it 700 pounds?
No, we distributed 2,300 pounds of food at one visit.
At one point.
We distribute 700 pounds of ground beef.
Oh, that's right. So that's coming again every month for the summer. They, like many other people, will not drive up here if it's remotely snowy. Spanish support, we really want to expand this. Hopefully we'll have time now too. We really want to help promote and have systems in place for better translation, better interpretation, just an automatic, like across the board protocol policy for being able to reach our entire population in an equitable way. Care coordination, we've really done that through a lot of the senior programs and senior visits. And then also, you know, just a lot of us, we get a lot of stuff that I do is text someone back and say, yes, I think that's urgent care, or do you want me to help at the clinic? So, you know, that's just really a fun part of our job, to be honest. We really have a good time with that. We are gonna have the resource fair that Dana did in the fall with a lot of regional partners. As she said, a lot of people get funding outside the area, but they don't have the capacity to actually bring it to us. We need to meet them in the middle. And that's what Dana's been able to accomplish a lot of. You know about the senior meals. The last one is this Wednesday, and we'll let the restaurants and being able to get outside and be mobile take care of everybody, because that's really fun. And then we support our community. And Mana Soup Kitchen really helped with that. And then a lot of us just made food and we just had a lot of fun. We had a lot of people come. I think I counted an average of 320 maybe meals that we served and delivered. One thing that is interesting though, we used to have a list of about 10 to 12 seniors that we would either deliver to or really be worried about. And you guys, our population kind of took a hit this last year. We had people that had to move to better care facilities or that passed away. And so that's really been interesting of such a high need a year or so ago to changing. So we also, Mana Soup Kitchen is able to help with rent assistance and prescriptions. And so we made that connection with Lisa, who is bilingual. She also comes up with our DMV to go. We're bringing it up for the second year. And it's where you can do anything with your driver's licenses, renew it, get an ID card, blah, blah, blah. It's going to be at the Silverton Public Library this year, which is really exciting. And that's going to be in the middle of May and also in the middle of September. So they're coming twice. And, you know, just continually trying to promote things. We couldn't do it without our partners through the schools, both schools and social services. and EMS, Sheriff's Department, and it goes on and on. We've really met with a lot of people and just done these task force to really try and pin down this public health improvement plan. And so now it's done for 5 years. And yeah, we're really excited. What did I miss?
No, that's great. Now we get to work on it.
Okay.
I think a key piece here is, again, trying to recruit the partners, build the relationships. It's connecting with all these whole variety of folks that are both here locally and regionally. Next slide, please, Marina. Becky can talk about what's coming up. This is like immediately coming up.
You guys, the health fair is going to be awesome. 365 and 9 News are no longer, they didn't make enough money in the state. So we are doing our own. We could not do it without the Silverton Clinic agreeing to do blood draws under their nurse practitioner. You just show up. You don't need an order. It's a suggested donation of $25 or less. You get a complete blood count, a complete metabolic count, hemoglobin A1C for your diabetes, lipid panel, what else, which is cholesterol, thyroid. I mean, they took everything that's typically ordered by a doctor and it will be there. You might have to stand in line for a little bit, maybe. We don't know. We also changed the time because we really, a lot of times when we do it 8 o'clock on a Saturday morning, typically either snows, so people driving there, it's hard, but this time we're just really doing it also with local providers. San Juan Silverton Ambulance is going to do our vital signs, which is awesome. We're going to have lots of booths there, Innovation Medical as well, medical provider. And then at the very end, you get either vegetarian or meat chili and some cookies from the grocery store. So this is, we really love you to come out, even if you already have a doctor who's ordered your labs and you don't need it, you know, you got insurance that'll pay for everything. Please just stop by if you would like. We will have 2 bilingual interpreters there. And we just hope that, you know, people just come out and celebrate health, even if you don't want to take advantage of any of the things. But a lot of times what happens, if I want to go get my blood drawn, I have to pay a couple $100s because I have a high deductible to go to the doctor, to order the labs. And then I go back to get the interpretation. That's another $100 and $200. And then so imagine, and I have health insurance, imagine someone that doesn't have health insurance. So all the labs will be mailed directly to your home. You can look at it. You can go to a doctor. You could go to the free clinic on Thursday if you want, or at least just get hit with 1 bill for your insurance, you know, to go and interpret if anything looks out of whack. So we're really excited about that. CDPHE is coming into town. Thank you, town. Thank you, Sarah, for agreeing to host them for these classes. And Anna also really helped. And that usually happens yearly. We try to do that yearly. And then maybe they're doing their inspections around town. I don't know if that's that day or not. Mobile Market, first one's May 21st. And then the DMV is going to be, May 14th. So before then at the library. So.
And again, DMV to go, great resource. Look at your driver's license, see if it needs renewal. It's very helpful. And the mobile market, there's no income qualifications. So again, we have some people who are like, well, I don't know, but really they love to come up here and distribute as much food as they can, right? And we all can use an extra bag of groceries in our fridge. We talked about area median income here. One statistic we talk about is that San Juan County has one of the lowest area median incomes for the county. So even if we don't all qualify for these programs, kind of for the ones that have income qualifications, Mobile Market is just happy to come up and distribute, and they often have local stuff. So again, they're very excited to come up here, and the more that they distribute, the more they love to come up here, and we're going to get them up here monthly. But we just really saw a variety of our residents where it saves a family a tank of gas to go down to Durango. Instead, they can access some of it here and stay in town. So come on out. All right, 2 more slides. We're kind of talking about looking ahead. Again, like, why does this all affect us as the town board, you as the town board? Just thinking about sustainability, right? As Becky said, all of this is grant funded. So all of these programs are always vulnerable. We're always vulnerable to a partner not being able to provide services. Right now, we're really excited to have 2 medical providers here, but we don't know what the sustainability of the Silverton Clinic looks like if one of our providers were to retire. We don't know, how long we can continue to partner with innovation. If we try to recruit a dental provider up here, it's just all really dependent on 1 or 2 individuals. So just thinking about sustainability and how we grow that and build it. And thinking about, the future of healthcare and the healthcare building or partnering with the EMS, just what does it look like in our community as we continue to grow and have these needs? And I think it all just comes to mind for us when we have passes closed or as we have residents getting older, and it's a challenge to age in this community. So just thinking about all those needs, we have a lot more babies born all of a sudden, right? The last town board approved a pediatric device for the EMS because they were having more babies in this town. So we're just working out what are the needs and what does it look like. But again, access to care is really the top, as I think we all know what a pain it is to get medical care outside of this community and even in the region. Next slide, please. I'm going to leave us with a quote from our very own Carrie Metzler. So when we did the community health assessment, Carrie left us with this great quote that little things are going to add up to big things. And I think we really see this, right? Becky and I have seen, and I know we know the grant story is as you're able to demonstrate success, as you're able to demonstrate, hey, we managed that money well, give us a little bit more. That's kind of what we hope is that we can make progress. We got the mobile market up twice and now they say, oh, we'll come once a month in the summer. So I think little things kind of chipping away at partners that we can work with really creates a big impact for our community. Because I know we all know in this town, a little bit goes a long way. So that's where we are.
Any questions?
Or from the report or anything else.
We
Everything's your-
just got word where you donated a couple of dental chairs. Trying.
And a provider, we're talking with a dentist who might be willing to come up sometime. So we're just,
Little chips away. So
conversations.
dental chairs maybe coming from Garfield County, if we can get over to Glenwood Springs to get them, and
we're all very scrappy.
just little things.
Silverton scrappy.
So.
I'm going to Glenwood Springs in like a month.
Stop.
I know. I love transporting things.
Is it your car now?
In touch. Thank you so much.
I was just gonna say, I went to the clinic last week for my knee and I really didn't want to drive to Durango to get a appointment for an MRI, drop back down to Durango and then have it read. So I just went in, they ordered the MRI, I got it done today. And it was so fast, it was so efficient. I so appreciate the service.
Great.
Incredible.
Great.
Good to
Great.
hear.
Any other thoughts or comments from your experience or things you hear or? Prescriptions, that's the other piece I want to tackle. Prescriptions, guys. I thought I found us a vending pharmacy machine, but it's not gonna work. It's so not gonna work.
Like a pest dispenser?
Yeah,
I've had big discussions with people who we could put out the vending machine for the strep test, HIV test, flu test, There's just really great technology out there that it's just hard with our population. When they say, oh, we could totally do that. And I'm like, yeah.
there's a lot of regulations,
And it just isn't worth it to a lot of people to do that. So, yeah. All right. Thank you.
Thanks, guys.
Yeah,
Thanks.
thank you very much. And sorry I was late.
Oh my gosh.
I appreciate it. That's so.
And you weren't late. We were just moving very quickly. Okay, thank you guys for your attentiveness. All right, now I'm putting back on the mayor hat and we'll move on in our agenda to new business, resolution 2024-13. A resolution authorizing the town of Silverton to open a sewer fund debt service reserve, sewer fund short-lived asset reserve fund through Colorado Bank in compliance with the USDA loan obtained from the rehabilitation of the sewer collection system.
All right. So in December, the town received funding from USDA in the amount of $2,165,000 for the loan and $2,764,000 for a grant. This is to rehabilitate our sewer collection system. The request tonight is to open 2 bank accounts in accordance with the letter of conditions from USDA for the purpose of a sewer fund debt reserve and a sewer fund short-lived asset reserve. The resolution reflects the purpose and amounts for each account. While staff doesn't explicitly need trustee approval to open these accounts, best practice is to have these accounts on record so that in 10 years, someone isn't wondering why we have 3 accounts with Colo Trust. This happened to me when I started. So record keeping. There's one administrative typo changing the date of the letter of conditions in the resolution from 2024 to 2023, since that was in December. And we can still make the motion as is. I also included information in this memo on enterprise accounts and a teaser for you all on how administrative fees are being charged. This information is for your context and like training. And we can definitely discuss the philosophy on administrative fees. This is probably not the appropriate place to do that, but wanted to kind of just start getting information out to you guys on how this all works. And John's here as well if you have any questions on the project.
I do have a question. In here, it says the Colo Trust does not meet the FDIC requirements
Correct.
for the construction account, but it earns more interest. So if we don't meet those requirements, how does that work?
So yeah, we're not going to open a construction account with Colo Trust. We are going to come back to you all and open it with the Bank of the San Juans, which I'm working with them right now on. But Colo Trust, the reason why we want to use them is that, first of all, their interest rate is really good. So it's about 5% interest. And then they are a pool of governments. So it's really easy for us to be able to pull. They understand how local governments work. So we already have our reserve funds with them. And it's really easy for us to pull things as well as track our funding a lot easier with Colo Trust than it is a traditional bank. Now, the traditional bank we're going to need to use for the FDIC insurance.
Any questions or concerns for John or comments? Or questions on the enterprise fund that we could answer, not philosophically, but just what is this?
I will tell you, I have issues with the way it's allocated at this point, but we can definitely dive into that as we go into the budget. And that's kind of why I'm prepping you all with this so that we can have that discussion in the future.
And I think this table is just a great way to show, like, we basically charge certain staff time and certain things in our general fund line item budget to those funds, recognizing that staff and general budget time and things go towards administering those funds.
I would just add that with respect to the USDA process, we're in for a bit of a ride here as far as administration goes. There are a lot of hoops to jump through, but the USDA offers really the most money at the lowest rates that we're aware of at this time. So it's really best from a staff perspective, it's going to be cumbersome. It's going to take time. But really these funds are not really available elsewhere. So we've got to go through a lot more steps than we might for a simpler type grant or loan process. So just be ready to jump when they say jump, and we'll get the money that we need to do our improvements.
Yeah, so after this, you all on the May 13th meeting will receive an ordinance for basically to go into that debt. And it's a bond ordinance. And there'll be 2 readings of that. We can't actually close on our bond until around the 1st or around the end of June, the 1st of July. So it's kind of a 2-month process getting through all of the hoops that they have outlined for us, as well as getting the bond approved. So hang on. Here we go.
Got another question for you.
Yeah.
On the master plan priority,
Mhm.
it talks about strategy A, and it says part of it is new utility infrastructure. If it's new, doesn't the homeowner have to pay for that, or the developer versus us on this project?
So on that, it's more, I think what that master plan is referring to is more of our wastewater treatment plant and our new infrastructure that we're going to get for that. This will be a rehabilitation of our current infrastructure, but John can explain that a little bit more than I can.
Sure, yeah, this project is primarily going back and repairing and replacing parts of our infrastructure that have been well, our sewer infrastructure began to be installed in 1904. So we have a lot of problems within our existing system that need to be improved, pipelining, some replacement. So that would be as far as master plan is concerned, this would be a maintenance item
Okay.
rather than new capital improvements.
Thanks, John.
And again, we're maintaining, this is for the sewer catchment system in the ground, right? And again, I got a comment at one of our chamber meetings about like, well, does that mean we're digging up all the pipes in the ground? And John helpfully clarified for us that we're relining them basically with new technology. That's helpful to kind of put in this liner so we're not digging up whole streets or something. That's not happening.
Hopefully.
There will be some.
We'll be digging a little bit.
But not every
will be
pipe.
some. Yeah, there will be some pipes that need to be replaced. So it's not going to be a completely painless process. But if you look at 120 years of aging infrastructure, we're going to have to do these things at times.
Yeah.
So there will be that, but it's not going to be every alley will not be dug up to replace a pipe. Most of them will be lined, and that should be relatively painless with brief interruptions of service. When I say brief, I mean hours, not days. The pipes that need to be replaced, those interruptions of service could be more extended, and we'll make every effort to communicate with our customers as to what those interruptions will be precisely, and try to control that as much as possible.
Thanks for the clarification, John.
And this is setting us up for a new wastewater plant as well. We are working on that at the same time.
Any other questions? All right, I'd entertain a motion to adopt resolution 2024-13, a resolution authorizing the town of Silverton to open a sewer fund debt service reserve and a sewer fund short-lived asset reserve fund through Colo Bank in compliance with the USDA loan obtained for the rehabilitation of the sewer collection system with the minor administrative edits.
So moved.
Second. Roll call, please, Melina.
Trustee Albertson?
Yes.
Trustee Gardner?
Yes.
Trustee Schnitger?
Yes.
Trustee Wakefield?
Yes.
Mayor Pro Tem Harper?
Yes.
Mayor Cranker?
Yes. Thank you. All right, moving on to approval of consent agenda items. Any comments or concerns before moving here? If you do have comments or concerns, that's when I encourage you to pull it out. It's a consent agenda. I just wanted to make kind of an administrative comment that's helpful for folks. I think we have the financials in there, right, for transparency. I find those to be really helpful to kind of dive into a little bit more in depth when more of the fiscal year has passed, right? We're very early now, so comparing it to budget is not super helpful, but and just, I think everybody is aware of this, but it's good to keep in mind that when you see the sales tax charts, whatever number is reported, it's collected 2 months in arrears. So if we're looking at 80,000 plus or minus reported in April, that's what was collected in February. So it's what was spent in the town collected in February. Makes sense? Okay, great. But yeah, as we have kind of a pretty seasonal economy, I think it's helpful to keep that in mind of what collection month we're thinking about. Okay, I'd entertain a motion to approve the consent agenda. So moved.
Second.
All right, roll call, please, Melina.
Trustee Albertson,
Yes.
trustee Gardner,
Yes.
trustee Schnitger,
Yes.
trustee Wakefield, Mayor Pro Tem Harper,
Yes.
Mayor Kinder.
Yes. Okay, moving on to staff reports.
All right. So you'll not find the standard staff report in this packet, as we wanted to show the trustees what we are currently working on. These lists do not include the items that are on our list that we haven't started yet. So this is just kind of what we're working on right now, or what we anticipate within the next year. And that goes to December. And then our Parks and Recs and Facilities Director is new to the position, so we've been working on year-long heat map, which is not really reflected in this packet right now. Do you guys have any questions on it?
Not. Gloria, when I look at yours, it makes me think of when I say, hey, Gloria, we should do fill in the blank. And you say, no, Dana, we should do the things that are already on the list.
Well, I haven't said no yet. That's why the list is.
Yeah. I think something for all of us to keep in mind, and as a new board and as an old board, our staff is pretty high capacity. And they're really like to say yes, because they like to say, we could do that. And I think as a board, we can do well, and we can talk about this at our trustee retreat, but we can do well at helping to help them say no. Because the list of things that are important is kind of endless, and the list of really important things kind of goes on for a while. And I always say our high capacity staff staying in their positions is the best chance of success we have in this community to keep things moving, right? If we all of a sudden lose Ann, all those projects that had all that steam, all those applications are suddenly poof. Like, we lose people in these key positions because of burnout. It makes us pretty vulnerable. So that's what I see when I look at these lists.
It was funny because we were talking today about all the stuff we forgot to put on the list.
That was kind of my thought. It's like, there's gotta be, I know this is a lot, but I bet there's more.
I am wondering what is on your future list too, of just knowing. If someone in the community is like, hey, this should happen, you're like, well, it's on the list for this time period.
Yeah.
Things they're working on.
So funny, Dana and I actually chatted about kind of how to manage that, and we're calling it the pineapple list. Because I didn't want to be triggered of that's the future to-do list. So we decided to take a trigger word out of it, and it's the pineapple list.
Just kind of the idea of if any of us are chatting with Gloria and saying, hey, I've heard this from the community, this would be a really great idea, we should do X. And Gloria can say pineapple, pineapple. Yes.
We'll go on the pineapple.
It's not the no, I won't do list. It's not the future to-do list that feels overwhelming. It's pineapple list.
I think I'm interested in being like, yep, that's on their list, they're aware and they're tracking. I think would be helpful too.
Yeah.
Okay.
Yeah.
Go into Gloria's office and look at her whiteboard.
It is on my whiteboard, yeah.
Beat you the other day.
But no, if you want that list, as far as I have that list, community projects and stuff, that I've been keeping since I started, so. Sometimes they get prioritized up and sometimes they just kind of stay on the list.
I think people come, at least to me a lot, they're like, this thing happening. I'm like, oh, okay. I'll note, or now it'd be great to be like, yep, it's on Gloria's whiteboard.
Yeah. Jim, you're laughing over there. Any comments?
Nope. Nope.
Just put it on the pineapple list, Jim.
Everybody needs a safe word.
Yep, I needed one.
A lot of food references tonight, I will say.
So many.
He did one too.
Well, and this is staff reports, but I think we can think of, trustee priorities, obviously. I think the standout thing to me is there is a lot on the master plan. Gloria does an exceptional job about tying staff priorities back to the master plan, right? And some of these things are just town operations, they have to happen. But even improving town operations was part of the master plan. And so I think to me, this gives a good bit of confidence that like what our staff is working on in town hall is really related to the master plan. And even if it's not moving as quickly, or there's something in the master plan or something on somebody's list in the community that they really think this should happen quicker, this should happen faster. I think, again, we kind of just have to have patience and diligence in remembering that there is a lot happening and a lot of it is behind the scenes.
And sometimes we'll jump ahead if there's an opportunity, like a funding opportunity or a partnership opportunity, like we'll make that call and jump ahead if we can, but, and that's what happened with like our project with SMPA and Eco Action Partners was we met as a board and the board said, we would like you to get some redundancy and power here. Like, how can we facilitate that? And that there was an opportunity and it kind of jumped ahead, so.
Yeah, so it doesn't mean don't ever bring things up, right? Like it,
Right.
we can have that conversation, but just helping us all be cognizant of the lists. Any other staff comment or questions for our other staff that are here?
I think there are times when we have to prioritize, so we're doing a priority and we're still listening to a request from a resident. And it's just because we don't do that right away, doesn't mean that it's not a priority to us, but there's something ahead of it that has to get done. And then there are other situations where we responded to something this weekend that we had to deal with right away. And it was critical. Not, fortunately, everyone was okay, but it's just knowing that it's like triage. I deal with it in my job all day and we all do it in a different way. And then we kind of try and build it to the mural that we want, and I think we're all open to hearing suggestions and listening to advice as well, or input, so.
Or when something like an election comes up, that becomes the thing at the top of my list. Everything that I was working on before the election had to wait until the election was over. And then everything else on the list bumped back up. And that's just something that we have to do. It's not like we can push off an election, so.
And I knew that when my other boss looked at me and asked me to be a judge, whatever you call it, I knew it wasn't a request. Just be mad.
How did you all feel doing these heat maps? On the staff level?
I made him do it, so I'll ask them.
I mean, when you looked at what's on your list.
It was good to make the list. Cause it's really, we have so many lists all the time. And so it was good to kind of try and pull all of them together. Look at everything all in one, even though since then I woke up at 3 a.m. and was like, something I didn't put on the list.
I think the best thing about it is it created awareness about what we were all doing individually. Now that we're able to see what other departments are doing as well, it brings awareness to how full of plates we all have. Gives us kind of a project management streamline ability to see what we're prioritizing and leaves room for open discussion with everybody else.
Thanks, Sarah.
It's a lot on the list. I think Dana's really good about this, but now I want to be an advocate of government's thankless work a lot of the time, and you only hear what you did wrong. So what are ways we're like celebrating staff for this huge list? And maybe I'll ask that as a board, besides the answer, not adding additional things, but how can we celebrate all this work at the end of the day?
Thank the teams individually and not the higher level. Go directly to, you mentioned the plows, parks, go to the parks guys and tell them they're doing a great job. They're working their tails off and we're nothing without the work. So that's helpful. They appreciate the recognition.
Plow guys, you didn't hear it, but I thanked you earlier because I hurt my knee and I can't walk anywhere in town except for around the track. You guys are great.
I think ways we can continue to tell the story of what town's working on. And Gloria, you've done great about that with town halls and stuff. But again, just continue to remind people of all the things that are getting worked on because there is always something that is important to somebody that isn't getting worked on, right? That's just a reality of the work that's happening or not happening for some people. So.
Yeah, but I'd be happy to share my ongoing list with you all at some point, if you'd like.
Okay, any other comments on staff reports?
Yeah, I think you guys all touched it, but just super important for us as a board to continue to support you guys as staff and know what your capacity is and what projects are prioritized to make sure that we're not putting too much on you. Because it's so easy for us to pass a policy or to say, I want this to happen, and then it's all on you guys afterwards. So I think just us being mindful about everything that you guys have going on while making decisions.
Don't overdo it and burn yourself out.
I'm going to be better about setting the pace. I have a really good team. I want to keep them forever.
I'm not going anywhere.
And as a board, I mean, we've had to do this before, is just helping Gloria know, supporting her that if there's a meeting she has to miss, like there's a meeting she has to miss, or we can reschedule some work session or whatever. Like we can be somewhat flexible as a public body. Okay. All right, moving on to committee reports. Finance Committee. Jim, I've talked a lot. Do you want to give an update on Finance Committee from April 15th?
You can do it because my internet's sketchy.
Okay.
for
Let
it.
me pull up the agenda. Okay, we had a Finance Committee meeting. Tyler, Jim, and I met. Something that will be coming before the board will be some changes to our fee schedule. So Sarah did a great job of kind of looking at our old fee schedule and thinking about new fee schedule. And that's specifically for kind of renting our facilities. So we talked a bit about the main points we talked about in that meeting was kind of how this still applies to like local nonprofits or community members and striking that balance between making our facilities a community resource that's accessible to locals, as well as using them as revenue streams for rentals, for weddings, for events. So kind of striking both of those balances, right? So that'll be coming before the board, as a fee schedule. And we talked about implementation of EQR rates, and Melina continues to work on that. And that relates to kind of how businesses are billed for refuse. Currently, our refuse fund is not sustainable. We have to keep transferring money from our general fund to the refuse fund, which is not best practice and has to, we need to make that fund sustainable. So we need to make sure that the fees that we charge for our refuse cover the cost the town pays to transfer the refuse out of town. So one way we're doing that is to bill businesses differently based on kind of size and type of business that they are. So Melina's working on that, and in particular, thinking about seasonal businesses, right? So not necessarily burdening seasonal businesses when they're not open for refuse they're not generating, but having an administratively doable way to have seasonal businesses kind of have exceptions. And then we talked about the lodging fee increase. So the last town board approved a lodging fee increase. There were several businesses, just a few, that indicated that they bill their lodgers quite a bit in advance, right? Many hotels bill it upon like you're at the hotel room, but for some of our RV parks, maybe some of our vacation rentals, they've already billed their customer, and so recouping that cost from the customer billing in addition was creating a bit of a burden. So we're just asking businesses that have kind of a financial hardship of having to cover the lodging fee increase out of their own revenues instead of billing it or passing it on to the customer, that they would submit a form to town staff. So there'll be more communication for the businesses that are affected by that. Let me see what else was in here. We had actuals. And That was it. Actuals and sales tax. Jim, anything you remember that I missed?
No, the only thing I would add was to maximize revenue. Sarah was talking about implementing a blackout program for specific dates so that we could maximize profit for our facilities. And I thought that was a brilliant idea.
Yep, thanks, Jim. Great.
Yeah.
Any questions on any of that? Any of those policies will come before the board. Okay, moving on. Looks like we had a San Juan Regional Planning Commission on 4/16. Who are our attendees?
That was me.
Lindsay,
First committee.
you want to do your first committee report, tag team with Jim?
Yeah, it was fun. So just two county items, two permit applications that came before us. One, was over near Howardsville. So it was application for a single family unit, and then a Airbnb. It'll be turned into an Airbnb. So that will, just look at the maps, it's definitely in a larger property than I think the public, just making sure the public is aware that that is happening and that's what's going on there. So we did approve that single family unit and the Airbnb application. So now we're at 16 of 20 of the allotted county Airbnbs, just for awareness. So there was one there, that will, they'll have some like historic items on there, including the mill and some of the old tram lines. So they're going to be restoring that. They'll put in a little bridge over the creek. Seems like they have according to our wonderful builders, they had a very thorough application. So I would definitely recommend looking at that. The second permit application was over in Minnehaha. Oh man, I'm forgetting the name of that. What they're calling a cabin now. Dark Star, you know what I'm talking about? No. Up on Minnehaha, they're gonna put in a new cabin, smaller, that we also approved that. No real impact to, the community. The only thing that we discussed was there's kind of the subdivision rules. And I think they're still looking into like what that's going to look like for them. So they'll probably bring it back to the board based on if they want to combine their two lots or if they want to use subdivision rules. That was it.
Thanks.
Interesting discussions.
Jim, anything to add from that one? Oh, I think you're muted. We can't hear you.
I do. Thank you. Lindsay was great. She called me to remind me that I was late to the meeting, but I could not attend. And I wanted to thank her for being attentive for me because I very rarely miss those meetings.
Thanks, Jim.
Oh, thank her.
It's a fun first one.
All right, on April 17th, there was a Bonita Peak Mining District meeting.
That was also me too.
Take it away.
I do back to backs. Well, I pulled up the wrong notes on those. Nothing really of to particular note other than we kind of talked about impacts for the summer. And so it does sound like there will be significant impacts in town, which we should communicate with folks about. Sounds like 800 trucks are going to be coming through town over.
So more than we saw last summer.
Yes.
Last summer, we were all like, oh, there's gonna be a lot of trucks coming. And it worked.
We should be able to collect on our traffic impact fees this summer.
Yeah, just so the board knows, the town quickly implemented a traffic impact fee because, right, that's a lot of wear and tear on our main road. Tell us more.
Yeah, last summer it was just outside of town. Now it'll be going directly through town. So it's gonna be a lot of trucks. So make sure everyone's aware of that. They also are aware of the cost to our roads. There will also be some other closures around the Alpine Loop that Anthony is going to work on putting together information for the community and the planning commission. There will be some more impacts to like just the general tourism.
And recreation.
Yes. So I think those are like the big public pieces at play. There's last thing is the May 30th, they're having a town hall to talk about what is going on. All of the offices will be there. It's gonna be fun. I think we're gonna make it a barbecue and talk about where not you should be able to drop your barbecue items out on the Alpine Loop. You know, is it gonna have arsenic in it? Or is it just gonna be dirt? So we'll have kind of an interesting conversation. I think it'll be a little bit more exciting than just going to talk to EPA officials. So that will be fun. Some new marketing materials will come out about that. So May 30th. For that, I think they're gonna try and put out a town hall. I don't know if that was the final decision yet. If anyone knows.
With the trucks, I'm still stuck on the 800 trucks.
Yes, yeah.
It's a lot of traffic.
How's that gonna be enforced?
The impact fee?
Total
Yeah,
number.
impact fee.
So we work with the EPA. They report to us how many trucks come through. John is aware of that. We have talked with them. We've also talked to their contractors about timing of those trucks, so that they're not coming through from 11 to 3, where we have the most busiest time. And I'm hoping that they'll listen to us, but it's also us going to the EPA, going to the contractor. So we're still trying to make sure that that is heard. That's one of my biggest concerns is safety, if we have that many trucks coming through. So timing it when it's
The people off the train that don't look. right.
exactly,
Straight, yeah.
they're looking up at the mountains, not the streets.
I mean, so we all met with EPA last year when we thought this was kind of happening last year. And they were definitely attentive and aware, and I would say kind of paying attention locally. They know that we have a bunch of tourists that are wandering across the street. But again, there's several layers here. So yeah, that's just a good thing to be aware of. And we can bring that up at the chamber meeting just so people know, but
I was concerned about dust too and the impact that would have.
I did notice Louis from the county driving the new
We do have a new truck.
water truck, so.
Yep.
Oh, I spotted that today. I was like, what is that?
Yeah.
So shiny.
oh,
Yeah.
what is that?
I think it's probably what's also like encouraging folks to attend the May 30th meeting
Mhm.
is like stressing the importance of like our summer tourism and what these 800 trucks are going to be doing.
Yeah, public engagement is great, folks. Public engage.
And it should be fun too, but want to let them know.
Jim, I saw you got off mute. Did you have any thing about the 800 trucks? Oh, that's all right.
Sorry.
Okay.
No, I was gonna add that we did have a great meeting. In fact, your father was in attendance. But what I found most impactful from that meeting was that the actual operators of the dump trucks, the operators are out of Montrose, and they are very cognizant of what we're looking for as a community with regards to the high volume of vehicle traffic.
Yep.
Yeah.
So I thought it was a great meeting.
Thanks, Jim. Thanks, Lindsay. Thanks, Trial by Fire, 2 committees in 1 period.
It was fun.
Any other trustee questions on that? Oh, okay, moving on. All right, trustee reports. Come to the health fair, get a bowl of chili. Even if you don't want a vaccine or blood drawn, just get some chili. We're gonna have a lot of chili. Okay.
Oh, sorry, I was gonna add one more thing. Just acknowledging it's Earth Day. So we always forget sometimes, but today is Earth Day, so happy Earth Day.
I was thinking of planting flowers today and it was like, it is not gonna not be frozen and for like July.
You
That's
should know this, Mother's Day.
no, it's Denver is Mother's Day. Here, it's Father's Day. Okay, well, it's lovely to be at a regular board meeting with all of you. All right, continued business. We don't have any continued business. All right, moving on to public comment. This is closing public comment. Melina, are people able to raise hands? We have nobody on in person. Is there anybody on Zoom who would like to make a public comment? You have 3 minutes. You can raise your hand.
I don't think that they're able to raise their hand in this version of it, but we have Melody.
Okay, all right, Melanie, we can hear you. You have 3 minutes. Please introduce yourself.
Melody Skinner, talking about Earth Day. I've been picking up trash. If everybody pick up their own block, the town would be in great shape. So please join me. Thank you.
Thank you, Melody. Oh, I will put a plug. Tyler and I are trying to organize a cleanup day. Date to be determined. So stay tuned. All right, that's closing public comment. And it is 8:10 and I adjourn this meeting.
Thank you, everyone.
Thank you.
Hi, Jim.
Close, Ron.
So efficient.